Hi everyone, warm greetings from the International Alliance for the Prevention of AIDS. Vanakkam from Chennai. I am Arulraj, the CEO of the organization. It is shortly called IAPA, and I am very happy today to welcome you all for this webinar on HIV/AIDS and COVID 2019. So before I proceed further, I would like to say a few words about our organization. IAPA was started in 2006. It was established with the mission of preventing the global spread of HIV through educational volunteerism. So we have been having a lot of education programs like the TOT and the mainstreaming, community education programs, etc. But what the flagship education program of our organization is the summer volunteer program, now recently called the summer internship program. Through which program, the students from the Arizona State University and University of Arizona come down to Chennai and teach HIV/AIDS curriculum in schools and colleges. This has been very popular since the beginning, and so far we have covered 98,381 students during these 14 years. During this program, we also involved students from the Madras School of Social Work as volunteers to assist in teaching. Since the summer program 2020 is not happening, we wanted to provide an education program on HIV/AIDS to everyone. But since we are in the middle of the pandemic, we thought we should include COVID-19 also. So we have facilitators who have developed this curriculum and they are going to present. So I'm very glad to introduce all of them. Madelyn, who belongs to SVP 2013 batch. She's a health technology, inspired ideas, research and development, director of Heal International, MSc Biology and Science. Madelyn Knowles, 215 batch of the summer program, learning and training manager, Center for Domestic Peace and ASU alumni. Both of them are alumni of ASU, Arizona State University. Brittany Hale, 2016 batch of SVP, contract tracer, New York Health Hospitals, a candidate of public health, postgraduate in public health, Mailman School of Public Health, and she's also an ASU alumni. Stephanie Christensen, 2017 batch of SVP, program specialist, Children Cancer Network, Global Health, BSN, pre-nursing student. So these people, as I was saying, are experts in HIV/AIDS, but COVID is 19 is different, and people are now only discovering. Scientists are discovering new things about COVID-19. So some of the things we discuss in this webinar may be different later on. So please look at it in this. We have this in mind before during the proceedings of the webinar. So HIV and COVID-19, both of them have similarities and differentiation. Both do not have a cure, even though HIV has some medicines, drugs to help them prolong life. And talking about the statistics, HIV, so far 76 million people have been infected with HIV since the beginning of the pandemic, and 33 million people have already died of HIV. Now there are 38 to 44 million people living with the HIV presently as on 2019. And COVID in these 10 months have infected 10 million people, and out of that 500,000 people have died. So this webinar is very crucial for all of us. So I will exhort all of you to take part in this webinar carefully and learn from it. Actually, we wanted to end HIV epidemic by 2013. For this, many strategies were developed by the global hub community to end the HIV, but during this process, this COVID, more deadly than HIV, has come into being, and so it is very significant that we learn about this. I hope the webinar will provide you a clear understanding of both the pandemics, and you will learn so many new things, so that it will pave the way for protecting yourself and your dear ones from HIV, and also share the information with the others. Once again, I welcome you and wish you a good learning and great interesting discussion. Thank you. Over to Madelyn.
Thanks, Louis. So we're going to start with Megan Allen, who's going to do her section on biology of HIV and COVID.
Yes, hello everyone. I hope you can see my screen. You're all good, you can see that. Well, thank you all for being here this morning or evening, depending on where you are in the world. My name is Megan Allen. I am currently in Tanzania in East Africa, and I was a part of the IAPA program in 2013. So it's been a number of years. I'm excited to be here, excuse me, excited to be here with you today to talk about HIV, AIDS, and COVID-19 and figure out how we can learn together throughout this pandemic. Here's a brief overview of our agenda for today. I'm going to cover biology and immunology very briefly, and then my colleagues are going to talk about different things related to transmission and prevention of both of these viruses, as well as testing and treatment. We love when you ask questions. So if you have any questions, there's a ability to chat in your screen. Feel free to type your question in the chat box, and we can answer them throughout. And at the end, there will be some time specifically to answer all of your questions. Here's a short thing that we're sharing is current as of today. So scientists are constantly learning new things about HIV and AIDS and about COVID-19 and the novel coronavirus. So we understand that what we're sharing is only true as of today. We will share with you the best information that we have today, but that tomorrow scientists might discover something new. And so we want to constantly be learning and continuously be updating our information with you. Finally, we are not medical professionals. So if you do have a question about your own health, please seek contact with a healthcare provider or a doctor in your area. Okay, let's start. Let's talk about biology. Biology can be kind of a heavy topic, so sorry we have to start with biology. But I'm just going to walk us through so that we understand the differences and the similarities between both of these viruses, HIV/AIDS and SARS-CoV-2. So first, just for a few definitions, HIV, as many of you know, HIV stands for human immunodeficiency virus, which means that HIV is a virus that infects humans and also impacts our immune system, makes it not work very well. AIDS stands for acquired immune deficiency syndrome. So AIDS is a stage in the progression of HIV, which some of my colleagues will talk about later. And this is just, so this is not the virus itself, but it is a stage at which someone has a poor immune system and is likely to get other types of opportunistic infections. And oftentimes people in the AIDS stage are very sick and are more likely to pass away from other infections. COVID-19 is a disease. So this is the name of the disease that we currently have, that we currently are in the pandemic of. And COVID-19 is the name of the disease, but the virus itself is called SARS-CoV-2 over here. And COVID-19 is a word, is an acronym to describe coronavirus disease. And it's 19 because it was found in the year 2019. So those are some definitions, and those will some of the words I'll be using. Importantly, for the biology section, HIV is the virus that causes the disease called AIDS, and SARS-CoV-2 is the virus that causes the disease called COVID-19. Okay, not to get into biology too much, but just so that we have an understanding of what basic biology is and how our bodies work. Many of you, if you've participated in an IAPA program, you've seen something similar to this slide here. So biology is the study of all living things, and it covers a variety of topics, including the smallest unit of life, which is called the cell. As all of you know, all organisms are made up of cells, trillions and trillions of cells inside of our body. And every cell, regardless of its function, contains all information that it needs inside of DNA, or deoxyribonucleic acid. So all of the information that our bodies need in order to generate new cells is housed inside of DNA. So essentially, DNA serves as a blueprint. We can call it a blueprint or a set of instructions for the replication of cells, specifically to make proteins. So, and because DNA is so important for the replication of cells, it is protected inside of the nucleus of our cells. In order for our cells to create DNA goes through a process translated into proteins. This is it's called the central, is the basis for the. You don't need to know all of the steps now. It's just important to remember because this relates to how viruses replicate. So then what's a virus, right? If our body is made up of a bunch of cells that replicate over and over again, a virus is a microscopic infectious agent that can replicate, but only inside of the living cells of an organism. So by itself, outside of a cell, outside of the human body, let's say, a virus cannot replicate on its own. Instead, it gets inside of some host, let's say a human in this case, because both of these viruses are human viruses. It gets inside of a host and it uses the host's resources, their energy, their enzymes, everything that they use to create new cells. The virus also uses to create new cells, new viruses, I guess. And here on the side here, you can tell that viruses look different from each other, but many of them work in the same way. It kind of depends on the virus itself. We are, of course, focused on this virus up here called HIV, as well as, oh, there's no coronavirus on here. I should have put a coronavirus, I guess. But we're focused on this virus here, which is HIV, and I'll show you a photo of what a coronavirus looks like as well. Most viruses have some sort of genetic material on the inside, like our own cells. So it has DNA or RNA. and then it has some sort of protection, some coating to protect it. So HIV, like mentioned before, is a specific type of virus. And it is a virus called a retrovirus. And this is just a fancy name for a specific type of virus that does not follow this central dogma of biology. So I mentioned before, the central dogma of biology is that DNA gets translated into RNA and transcribed into proteins, right? So HIV does not do that. HIV does not follow that same path. And that's because HIV's genetic material, which is inside of this nucleus here, is not DNA. Instead, it is RNA. So what HIV does, it gets inside of our cells, and it uses our cells to create its own DNA, and then it takes that DNA and it puts it inside of our own DNA. So this is confusing, but it's an important point. HIV gets inside of our cells, and then it does something called integrate into our own DNA. And this is important because once HIV gets inside of our cells and integrates with our DNA, it is very difficult to take it out of our DNA. It's able to hide inside of our own cells and inside of our own bodies and replicate forever until it can no longer replicate because our body is no longer replicating. So that's an important point, and it's different from the coronavirus. So I wanted to make that clear. HIV is a virus that infects a group of cells called CD4 cells. Oh, sorry. It infects CD4 cells, and these cells are part of our immune system. So this is another important difference from the coronavirus, is HIV is infecting immune system cells, and our immune system, of course, helps us fight off infections. We'll talk more about that later. Okay, so here's also, let me go back very quickly. Here's an image of what the HIV virus looks like. All of its enzymes, all of its receptors, everything. And it's quite complex. HIV is quite a complex virus. SARS-CoV-2, on the other hand, the virus that causes COVID-19, is a more simple virus. You can see here, it has some genetic material on the inside. It's surrounded by a capsid to protect it, and it has some receptors on the outside so that it can connect with cells. SARS-CoV-2, like I mentioned before, is a new coronavirus, but there are other coronaviruses that are known to infect humans and animals. So there are other coronaviruses such as SARS and MERS, the severe acute respiratory syndrome, and the Middle Eastern respiratory syndrome virus are both caused by coronaviruses. And this virus is just new. So even virus, we do know some things about the family of coronaviruses, which is helpful for us when we're doing research. Specifically, the difference between SARS-CoV-2 and HIV in terms of replication is that when SARS-CoV-2 enters inside of the human body, it gets itself into certain cells, mostly in your lungs, but also in other places in your body, but mostly in your lungs. And when it gets inside of those cells, it does not put its own genetic material inside of our own genetic material. So that's the difference between HIV and SARS-CoV-2, is that COVID-19 will use our cells forever, which means we can get it out of our cells, right? We can get healthy, we can get over the disease, and we can also hopefully find cures or treatments or vaccines or something to be able to help us to fight this virus. Specifically, this SARS-CoV-2 virus binds with cells that have something called an ACE2 receptor. And there are many cells in our bodies that carry these ACE2 receptors, but largely they are in our respiratory tract here and down into our lungs, as well as in our GI tract, our gastrointestinal tract, which is why many people with SARS-CoV-2 have issues of their gastrointestinal tract. And because it goes deep into the lungs, because it infects these cells that are here, it of course causes someone's lungs to become very inflamed, and it has a lot of effect on the body's immune system, which is trying to fight it off. So we don't need to talk a lot about the immune system. I just wanted to make a point that we want to understand how is the immune system being affected by both of these different viruses, because it's affected in different ways. And this becomes very important because our immune system is supposed to protect us, right? Our immune system is created and it protects us against all of the pathogens that could come and make us sick, including our immune system also includes things like our skin and mucous membranes in our nose and in our throat. So we use all of these defenses as well as ones from viruses like HIV and SARS-CoV-2. There are two parts of the immune system that I just want to show you, although the immune system is very complex. And I don't think, if any of you study immunology or know about the immune system, you will know that this is a very simple representation of the immune system. But if you see here on the screen, you can see there are two sides. One is called the humoral response. The other side is called the cellular response. Both of these responses happen when a virus or a bacteria gets inside of our body to make us sick. And both of these are mechanisms that our body uses in order to fight off that virus. Specifically, I want to talk about this side here, the humoral response. Okay, in the humoral response, the main activity is that a virus or a bacteria that gets inside of our body signals the immune system to make something called antibodies, which are down here, these red lines. Now, this is a complex process, but making antibodies then helps our body to fight off this specific pathogen, this specific foreign body. So these antibodies are specific to this pathogen here, right? And in order for us to make antibodies, we have to go through a series of steps. This cell called the macrophage has to notice the foreign body. This cell called a helper T cell has to signal some different cells. So there are many processes that happen in order to make antibodies, right? But that's one of the very important things, is that our body is able to create defenses against these viruses in many cases in order to be able for us to, one, fight the virus off now, as well as fight the virus off in the future, right? So ideally, we can create antibodies so that if we get sick in 6 months, we are also able to fight off that pathogen. There's an important thing to note here, which is that for SARS-CoV-2 or COVID-19, we don't know entirely if I get sick today, if next year I will be able to fight off the virus. We don't know if we make these antibodies to last a long time. But that's another question. So if you have questions about that, let me know. Okay, so just want to touch on how both of these viruses impact the immune system. So if the immune system is there to help us fight off these viruses, both of these viruses do very interesting things inside of our body. So when HIV infects someone's body, what it does is, you remember I said that it infects cells called CD4 cells. Most of you probably know this. These two cells here that I put X's on, the macrophage and helper T cells, are both CD4 cells. They both have the CD4 receptor. So HIV comes in the body here, and it infects this cell as well as this cell. So now, if a new virus or a new bacteria, let's say, comes inside of our body, we don't have any macrophages and we don't have any helper T cells because HIV has infected them, and most likely they've been killed. They've been like lysed off. So now that we don't have these two very important parts of our immune system, someone who has HIV is more likely to get very sick from a normal bacteria that can get inside of their body. And that's because when that bacteria comes, their body is not able to create any antibodies against it. And this is one of the main reasons why people ultimately get to the stage of AIDS, or acquired immune deficiency syndrome. This is the very late stage of the HIV infection. And this is because their immune cells are being killed, and their immune system is then no longer able to fight off other infections. Now, SARS-CoV-2 or COVID-19 works a little bit differently. So this chart actually starts here on the right, up here. COVID-19 enters the body. So you can read it, it goes around this direction. But when the virus that causes COVID-19 enters into the body, remember, it doesn't get inside of our DNA. So instead, our body is very good at creating an immune response against this virus. Whereas for HIV, our body is not great at making an immune response. So once COVID-19 or SARS-CoV-2 gets into our bodies, this whole immune system response happens. The humoral response as well as the cellular response happens. That's what's happening all the way through here and even into this part. Now, as our body is trying to fight off a SARS-CoV-2 infection or a COVID-19 infection, our body does something very interesting. The interesting thing is that our body works very hard to try to fight off this virus. And that is in fact one of the reasons why many people get very severe condition, have very severe symptoms, is because our body works so hard to try to fight off this virus that it creates a situation where our body starts attacking itself. And there are a lot of reasons that this has happened, and some new research I just read yesterday actually about this, which is very interesting. But you should just know that while our body is trying to fight this off, our immune system is working so hard that it actually starts attacking ourselves. That's what causes this critical condition here that you can see. All right, and my last slide is just to point out some of the similarities and differences, right? Because today we're here to understand both of these viruses, to understand what they are, how they're transmitted, and how we can prevent them. Most importantly, I think how we can prevent them. But just so that we understand a little bit about how they're similar and how they're different. So as you've seen, as we're going through, both of these viruses get inside of our own cells and use our own cells or our own bodies in order to replicate, right? But the difference is HIV integrates itself into the genome of the host, into the DNA of the host, and SARS-CoV-2 does not integrate. Instead, it infects cells, it uses cells, and then it goes out. HIV is a virus that mutates very, very quickly for some other reasons that we didn't discuss a lot, but it mutates very, very quickly. And that makes vaccine discovery very difficult. It's one of the reasons finding a vaccine for HIV is very difficult. On the other hand, SARS-CoV-2 has lower mutation rates, which is helpful when we're trying to discover a vaccine or create new treatments for a virus. And finally, like we just saw, HIV does not have a strong natural immune response. Instead, it takes out the immune system. It makes our immune system deficient. And SARS-CoV-2 does mount a strong immune response, sometimes so strong that it actually impacts whether or not we get severe disease. So I think that's all about the biology. And that was a lot of things very quickly. So if you have any questions or comments or thoughts, please let me know. Please type them in the chat and I will answer them at the end. And thank you for listening.
Hi, everyone. My name is Stephanie. I will jump in now to teach about transmission and prevention of HIV and AIDS and COVID-19. Next. Thanks, Megan. So first, there are a lot of misconceptions, as we know, about both HIV and COVID-19. This lack of understanding can really heighten the fear of the virus transmitting and stigma of people with the virus. So let's educate ourselves so that we can learn how to educate others. Next. For HIV transmission, some of you may know, HIV can be transmitted through 5 types of body fluids. And it can be transmitted if any of these 5 come into contact with 4 types of body openings, what we call doors. So for this to happen, the fluid would have to be HIV positive or containing HIV. And how does a person know if the fluid contains HIV? Well, the person has to get tested. It's essential. So take note on this. The 5 fluids that can transmit HIV if a person has HIV are blood, semen, vaginal fluid, pre-ejaculate, and mother's milk. Now, a door must also be present. So the fluid has to meet the door. The door would be another person's opening, and that other person could be HIV negative or HIV positive. So the 4 doors are an open wound, like a cut, an opening into the blood, the anus, the vagina, or the tip of the penis. So if you will, at home, if you feel comfortable, repeat them with me right now so you remember them. We're gonna say the 5 fluids: blood, semen, vaginal fluid, pre-ejaculate, mother's milk. Now the 4 doors: open wound, anus, vagina, penis. This is a tactic that we have used to teach people, to teach students or semi-literate people about how HIV transmits. So by sharing this information and by being very beat and making everyone say the words with us, it can help reduce some of that stigma of how perhaps inappropriate these topics seem, because we're all saying it together. So we're trying to bring down the stigma. Next slide, please. So the three most common transmissions of HIV happen when fluid meets a door, as I said. The top is sexual transmission. That is the most common passing, but not the only passing of how HIV can spread. Another is blood-to-blood transmission. So when HIV positive blood gets into someone else's bloodstream. And the last is mother-to-child transmission. So if a mother has HIV, she can pass it to her child in a number of ways. I'm going to try to make this interactive. You may use the chat, or Madelyn might be able to help with unmuting. Can anyone tell me what fluids and doors are present in sexual transmission? You can think on that. Remember, you can use the chat if you don't mind. How about blood-to-blood transmission? That one is straightforward, right? Blood and an open wound or a cut. Thank you. Great answers. Semen, yes, that can be a fluid in sexual transmission. Blood can be a fluid in sexual transmission. So can vaginal fluid, and so can pre-ejaculate. So that's why sexual transmission is the most common, because 4 out of the 5 fluids can be present in sexual transmission. So what doors can be present? The vagina, anus, and the tip of the penis. And what about mother-to-child transmission? If you could type in the chat, does anyone have a guess of what fluids could be present there? Good. Mother's milk in breastfeeding, blood during birth, or while the baby is in the womb, the blood into the placenta. And now the doors for those examples would be an open wound in the baby's mouth where they are teething, an open wound in the placenta getting into the baby's bloodstream, or open wound on the baby's skin during birth. Thanks for participating. Next slide. All right, so let's talk about prevention. Luckily, due to all of the research we've gathered, there are many ways for HIV prevention. And it's important to stress when you're teaching about HIV that people with HIV can live a normal and happy life, and they can have normal relationships too. The #1 way of prevention is through testing, because one cannot know if they have HIV unless they get tested, especially a mother. All mothers should get tested. Next slide. Okay, so as we talk prevention, we'll start with sexual transmission. So we go by the ABCs rule at IAPA. A stands for abstinence. So if a partner, one partner and another partner, or even multiple partners decide that they are only going to have sexual relations within their relationship, and they have both or all been tested for HIV and they are all HIV negative, then HIV will not enter into that sexual relationship because they're practicing abstinence. B stands for being faithful. Oh, I skipped ahead. I apologize. A, abstinence, is refraining from sexual relations at all. No sexual relationships, you have none of the fluids in sexual transmission and none of the doors. B is what I talked about earlier, being faithful. So if partners decide to only have sexual relations in their relationship and they've gotten tested, then HIV will not come in through sexual transmission. C would be condoms. Condoms. So there are some specific rules about using condoms in sexual transmission. The 3 C's to condoms are: 1, correctly. So we often stress in our teachings, correctly means according to the instructions on the condom pack. It means do not ever reuse condoms. Do not wash them and hang them up to dry. We like to put in a little bit of humor to make people feel comfortable. Consistently, using the condom every single time a person has sexual intercourse. If anyone decides, oh, just once not to use the condom, well, then during that time, perhaps the fluid that might contain HIV could enter the door. And so it's important to use condoms every single time. And finally, continuously. So throughout the entire time of sexual intercourse. Pre-ejaculate happens towards the beginning of sexual intercourse. And so if someone decides not to put the condom on until later, or to take it off halfway through, well, that's not going to work, because that does not protect a person the entire time from fluids meeting someone else's door. There are many ways to access condoms. Local NGOs like IAPA or ARM or other NGOs in the area, I'm sure some of the people present on this call do provide free condoms to the community for this purpose. Some barbers are also knowledgeable about where to get condoms, and there is a website called Condom King that provides discreet shipping to a person's house if they do not want anyone else to see. Next slide. So in blood-to-blood transmission, anytime a person shares a sharp object, so this object could be a razor if there's only one razor in the family to share, or a needle, maybe a needle with insulin or anything else being injected. If multiple people share that same sharp object, what can happen? Well, the blood from one person can get on the sharp object, and then when someone else grabs the object and uses it wherever, they open up a wound and the blood can enter the bloodstream. So that's why we say the few ways to prevent blood-to-blood transmission. Number 1 is do not share objects. If it's possible to get a new object, please do. That way a person can be sure that there was never any blood on there at all. Number 2 is if you must share an object, boil it in boiling water for about 30 minutes to ensure that the virus is killed. Because boiling water, the heat can kill the virus as long as it's hot enough and has stayed in the water long enough. Number 3, if it is a metal object, it can be heated over an open flame until it's red hot. And it's better to boil an object, but if a person only has a flame and not water, then a flame can be used. And number 4, if someone does not have access to heat and cannot get a new one, then the best option would be to wash the object very thoroughly with bleach if it's available and water, or with soap and water. And remember, this is to prevent HIV positive blood, which can be determined if someone is tested positive for HIV, from entering someone else's open wound. Next slide. Finally, mother to child transmission. This is very important. So some people might not know that they have HIV. So anytime a woman gets pregnant, she should be encouraged to get an HIV test. If she is HIV negative, she should not worry about transmitting HIV to her baby. But if she's HIV positive, she can start taking antiretroviral medication, which is a medication, ART, that combats HIV, which we said earlier was a retroviral. Now, the two most common ones in India are AZT and nevirapine, and these are available in hospitals throughout India. And if a woman starts taking these medicine, even while she is pregnant, this medicine helps reduce the viral load, the amount of HIV in someone's body. So it lowers the likelihood of HIV passing to the child. Also, if possible, the woman can have a cesarean section because when a woman gives birth naturally, the baby can get a lot of wounds on its skin from the force and the pressure of the birth. And those open wounds on its skin, vaginal fluid or blood can enter into those open wounds. And so if possible, a cesarean section can avoid that harsh force, and instead it's a surgery that can remove the baby without a mother having to push through delivery. Finally, when a baby is about 3 to 6 months old, the baby starts to grow teeth. And when they grow teeth, they also get open wounds in their mouth. And so when a mother breastfeeds and her mother milk enters those open wounds, that can infect the baby also. So if possible, a mother can switch from mother's milk to formula at 3 to 6 months. And also if a mother is taking ARTs, which like we said reduces the viral load, then that can also help reduce the likeliness of transmission. Next slide. If you have any questions about HIV transmission through sexual intercourse, blood to blood, or mother to child, or the ways we talked about for prevention, ABCs, the 3 Cs, those 4 blood methods, or for a mother, please put them in the comments. Next slide. Now let's talk COVID-19, transmission and prevention. So when HIV was new, it stirred up a lot of fear, and COVID-19 is doing the same thing. So both viruses can lead to these secondary infections that Megan briefly mentioned, like pneumonia, that can result in death if the infection is too strong for a person's body. So because people living with HIV or PLHIV are immunosuppressed, the US Center of Disease Control has recommended that immunosuppressed people social distance or stay at home or stay away from other people as much as possible. But there's no evidence that having HIV makes a person more likely to catch COVID-19. It's just a matter of if someone has HIV and their immune system is already weak, it might be harder, they might have worse symptoms when they get COVID-19. Next slide. So how is COVID-19 transmitted? The World Health Organization says mainly through respiratory droplets. So one person who has COVID-19, if they are talking, coughing, or sneezing, and their droplets get expelled from their mouth and can land on another person. And similar to HIV, COVID-19 is looking for a way to get into the body. So an often way, like influenza, for it to get into the body is through the nose, the mouth, the eyes. And people with COVID-19, some of them might not have symptoms. So they might talk or sneeze, and it could pass to someone else and they wouldn't even know it. While HIV can only be transmitted through the 5 fluids that we talked about coming into contact with the 4 doors that we talked about, COVID-19 transmits through the air. So if possible, a person should stay 1 meter or 6 feet away and wear a mask if possible. Next slide. So can COVID-19 live on surfaces? The droplets can be quite heavy, and so sometimes they do sink onto surfaces like a table, a doorknob, handrails. Some studies have shown that they can live on stainless steel or plastic for up to 72 hours. But this is not more research has to be done. This is just some of the studies have pointed to this. So it's very important that business owners, if possible, sanitize their doorknobs and their counters, wipe it down with alcohol-based sanitizer. And by the same measure, if individuals have hand sanitizer or access to soap and water, that they wash their hands often and they use hand sanitizer after touching an object. Now, we know that having access to sanitizer is not always there. That's not always possible. So a really good practice that you can teach people is to try to not touch their face or touch objects that are being touched by a lot of people. If someone has to get on the bus, try not to touch the handrails as you get on the bus. And if you can go into a bathroom once you're off the bus and wash your hands, do that. Furthermore, if someone is worried about COVID-19 landing on their clothes, they can follow the practice of leaving a spare set of clothes by their door, either by their front door or maybe in their garage. And if they'd like, just strip it off when they get home. Take off the clothes that they're wearing that might have COVID-19 on them and put on a fresh pair of clothes that the person knows does not have COVID-19. Next slide. So why wear a mask? Well, because we talked about those respiratory droplets, and we talked about the fact that someone with COVID-19 might be asymptomatic. There are many people who might have COVID-19 and not know that they have it. So if someone has access to a mask and they can wear the mask, that mask will prevent respiratory droplets from their mouth from spraying out and landing on objects or landing on someone else. So when I put my hand up, it blocks the respiratory droplets. Not as well as a mask, but that's why. So we wear masks to protect others. It doesn't necessarily prevent respiratory droplets from getting in, but it does a good job keeping respiratory droplets from going out into the air. And if everyone or a large amount of people can wear masks, then it has been shown to be able to reduce the amount of COVID-19 in the air. Again, if someone is able to get tested to find out about their HIV or coronavirus status, it's important that they do so, because then they might know if they are positive, whether they're symptomatic or asymptomatic, and they can isolate if they have coronavirus or go get ART if they have HIV. Next slide. And what about a vaccine? Well, vaccines would be prevention. Yes, similar to like a flu vaccine is prevention for people to stop people from getting the flu. Currently, a lot of countries are working to find a vaccine right now. There is one that has been approved in Russia. However, it has not passed phase 3 of trials yet, and all vaccines need to go through all 3 trials in order to be regarded as safe for humans. So some people believe that it needs to go through that 3rd trial before being truly approved. And just an interesting note, while many people have tried to make an HIV vaccine to prevent the spread of, to prevent people from getting HIV, because it's a retrovirus, like Megan said, it is very difficult and it hides in our immune cells. So a vaccine has not been created for HIV. You can go to RAPS or RAPS vaccine tracker to learn more about the current coronavirus vaccine. Next slide. Okay, the takeaways. For COVID-19 prevention, the World Health Organization says people living with HIV should practice the same things that the general public is practicing. Wash their hands often, physically distance 6 feet apart or more, staying at home works too. Use cough etiquette, unlike the man in this picture here. And that way you can avoid spreading respiratory droplets. So if you have a mask, wear a mask. If you don't, just make sure you're using your elbow. Self-isolate if you have been in contact with someone with COVID-19. And specifically for people with HIV, make sure that they have 1 to 6 months of their antiretrovirals if possible. That way they have their medicine for the next few months, and they get their flu shots and pneumococcal vaccination. And next slide. Any questions about transmission or prevention, go ahead and put it in the chat and we'll answer in the Q&A. Thank you, everybody.
Okay. Hi, this is Brittany, and we're going to now be talking about the progression of HIV, AIDS, and COVID-19 in the body. You can go to the next slide, please, Megan. So there are 4 stages that every HIV positive person goes through between infection and death. The time it takes for someone to go through these stages depends on the individual, their lifestyle, and their own immune system. But it's most important to remember that HIV can be transmitted from an HIV positive person as soon as they're infected, as well as throughout all 4 stages. So this diagram on the slide is a good way to see how HIV impacts the immune system and also to explain to other people how it works. So the x-axis, which is on the bottom, is the time from infection to death. So maybe somebody is infected with HIV at age 20 and they die at age 80. So that's the 60 years. The blue line that starts at the top is the amount of CD4 cells, which are the body's immune cells that Megan talked about earlier. And the red line is the HIV viral load, so how much HIV is present in the body. So the first stage, which is the first little quadrant on the chart, is the primary infection stage. So this begins when a person becomes infected with HIV. This stage can last up to 2 months, resulting in a very high viral load of HIV in the person's body. So as you can see, the bottom of the red line is when they were infected, and then it gets really high, and that's how high the viral load will be. After a few months, the body's immune system begins to recognize that HIV is in the body, and it starts to begin to produce antibodies and to try to fight it. And that's why the HIV viral load goes down, and you see that the CD4 count starts to go up. It's important to note that while in the primary infection stage, if someone is tested for HIV, they may receive a negative result. It takes time for the body's immune system to create CD4 cells and to create antibodies to fight off HIV. And so somebody's HIV test, which looks for antibodies, might not read positive. But again, someone who is positive and who doesn't know it can still transmit the infection to others. A person does not need to look sick in order to pass HIV. And that's why using prevention methods, as Stephanie talked about, are extremely important for everyone. So after the primary infection stage is the second stage, the asymptomatic stage of HIV, or the quiet period. In this stage, an HIV-infected person may look and feel completely healthy. As you can see, it's kind of a leveling out of the CD4 and of the viral load. And that's what helps make someone feel and look and seem healthy. There's like a standoff between the HIV virus and the immune system, and they're destroying each other at a recoverable rate. The length of this stage can vary by person. The average in India is 5 to 7 years, and the average in the US is about 10. So the quiet period is the longest period, and then we lead into the third stage, which is early HIV disease, or the symptomatic stage. So someone reaches this part of the HIV progression when their body has become tired from fighting HIV and the virus can't keep up with the viral load. This period can also vary greatly in length, depending on access to treatment and exposure to other kinds of illnesses or viruses. The only way someone knows that they have HIV is to get an HIV test. And testing is extremely important because the earlier the diagnosis, the earlier someone can receive treatment. Earlier treatment increases the possibility of keeping the immune system stronger for longer, even if it's weakened, and that can help someone live a longer life. After early HIV, it goes into the fourth stage of HIV, which is the AIDS stage. And at this point, the body's immune system has been weakened so that it's no longer able to fight off any other illnesses that it normally could. These diseases are called opportunistic infections because they use the opportunity to infect, and they're responsible for the symptoms that someone may see during the AIDS stage. So AIDS itself does not have any symptoms, but some common symptoms from opportunistic infections during the AIDS stage include sweats, chills, recurring fever, chronic diarrhea, persistent white spots on the tongue or on the mouth, persistent unexplained fatigue, and weight loss. Pneumonia is very common in the AIDS stage, as is Kaposi sarcoma, which is a type of cancer of the lymph nodes. This Kaposi sarcoma is considered an AIDS-defining illness. So if someone has HIV and then gets KS, they are officially in the AIDS stage. So this is kind of, it seems like it's not great news when you look at it because, I mean, it eventually ends in the AIDS stage, but that it doesn't have to end like that. A healthy lifestyle and antiretroviral medication can help strengthen the immune system and keep the viral load in check, even after the body has left the quiet period. So someone in early HIV or even in the AIDS stage can begin taking ART and can actually move backwards and live a long, healthy life in the quiet period. So that is the HIV AIDS progression. If you can go to the next slide, please. So similar to HIV AIDS, COVID-19 also starts with the exposure to a virus. So that is the farthest, I want to say left-hand side. When I'm looking at it, it's the left-hand side, it's in blue, and that's the exposure to the SARS-CoV-2 virus. The incubation period for the virus in the body is between 2 to 14 days. An incubation period is the time between the exposure to the virus and the onset of symptoms. So if you notice, it goes along, and then about 48 hours before symptoms start, the virus starts shedding and people become infectious. So 2 days before someone starts to show symptoms, they can already spread COVID-19 to someone else. COVID-19 symptoms include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle aches, body aches, headache, new loss of taste or smell, sore throat, congestion or a runny nose, nausea or vomiting, and diarrhea. So if you notice that you have any of these symptoms, or you know someone or you know that you've been exposed to someone with a confirmed or a suspected case of COVID-19, you should definitely contact your doctor and try to get a COVID-19 test. The symptomatic period, as you can see on the timeline, is usually between 2 to 21 days. It's on average 7 days. People usually say 14 days, so sometime in the 1 to 3 week range. Symptoms differ for each individual and by severity of the disease. Older people and people with other non-communicable ailments like heart or lung disease, hypertension or high blood pressure, or diabetes often have a harder time coping with COVID-19. This is kind of similar to HIV, where the body is working really hard to combat the virus and it can't fight off other opportunistic infections. So an HIV-free person can more easily fight off the flu, and a healthy body can more easily fight off infection from the coronavirus. That doesn't mean that people who don't have these kind of pre-existing conditions are any more likely to get coronavirus, just that when they do become sick with COVID-19, they have a better chance of fighting it and staying healthier. There are also people who are infected with COVID-19 who are asymptomatic and never have any symptoms, though they do have it. These cases are not that well understood because they're not often tested, but they do exist. And a lot of people predict that they amplify the spread of the illness. So it's important to make sure that every person, whether or not they have COVID-19, is doing things like maintaining social distancing, so 1 meter apart, wearing a mask every time they go out, washing their hands, and doing other kinds of cautionary actions. So as I said, the symptomatic period is 2 to 21 days. The entire time someone is symptomatic, they're also infectious, so they can spread the illness to someone else. Many patients recover within this kind of 2 to 21 day period, but some people will have severe disease requiring hospitalization. It's important to note that at the end of the symptoms, you should first always contact your doctor. And second, you should make sure that you are fever-free, symptom-free without medication for at least 24 hours. It used to be 72, and the CDC, the Center for Disease Control in the US, has now said that 24 hours is the threshold to be fever-free before kind of going about normal life again. There has been a recent case in Hong Kong of viral reinfection. Studies have not yet been published, but reports suggest that 2 different strains of the virus were present at each of the different testing dates. One was in March, and I think one was in August. Because of that, they believe that the patient was reinfected. So it wasn't just the same coronavirus strain that was in their body the whole time. An interesting point is that the second time the patient tested positive, they had no indication of being sick. So they had no symptoms at all. And they think maybe this could speak to the immune system doing its job, having some kind of antibody that recognized the virus in some capacity and was kind of able to fight it off. It's really not known how long immunity lasts. Some say people with COVID-19 have immunity to it for a couple weeks. Other people say up to 3 months, but it's not really clear right now. Vaccines will be helpful in preventing both initial and reinfection, but as Stephanie said, we're not really at the vaccine stage yet. So it's important to just make sure that you're being as cautious as possible and using social distancing tactics. Next slide, please. If you have any questions about the progression or anything, you can also ask those in the chat or at the end. So we're gonna quickly go through testing for HIV and COVID-19. You can go to the next slide, please. Okay, so testing for HIV/AIDS and COVID-19 is actually pretty similar. Especially for HIV, testing is the only way to know that someone has it. The sooner an individual finds out that they're HIV positive, the sooner they can begin treatment that will allow them to live a longer and healthier life, as well as protect their loved ones from contracting HIV. Similar to that, COVID-19 also requires a test to know for sure if someone has it. Some of the symptoms of COVID-19 mimic the flu, and so it's not possible just to look at someone and to know if they have COVID-19. Both tests are free. So government hospitals offer free HIV testing. government hospitals, primary health centers, and medical college hospitals in Chennai offer COVID-19 testing. Both the tests are very safe. The people who test you always use new and sterile equipment, so there's no risk of transmission. No one can get HIV or COVID-19 from getting a test. And also both the tests are confidential, so the only people who know the results of the test are the patient and the provider. No one knows what the results are unless you choose to tell them. Next slide, please. So this is a very handy infographic that I did not make, but I do like it. And the first picture is like a little finger with a little thing going into it, like a needle. And that is the most common way of testing for HIV. It's a finger prick. It's practically painless. It's super easy. Currently, for diagnosing COVID-19, they do a nasopharyngeal or oral pharyngeal swab, which is a fancy way of saying that they use like a fancy Q-tip or like cotton, a fancy stick that they put into the back of your nose and throat, and they swab for any active specimen of COVID-19. If you want to get tested for antibodies, they can do a serology or a blood-based test, and that can identify if someone has ever had the pathogen. Because we don't know, we as a scientific community don't know how long someone has immunity for COVID-19. It probably is best to be tested for antibodies like sooner rather than later. So if you suspect that you've had it, you get tested for the antibodies within a month. But I think like as we learn more about the coronavirus and particularly this illness, we'll be able to guess or to give more accurate numbers on when we should be testing for antibodies. Next slide, please. So specifically for COVID-19 testing in India, the Indian Council of Medical Research has set some kind of guidelines on who should be tested and why. So people who have symptoms of COVID-19 and have a history of international travel within 2 weeks, have come into contact with someone who tested positive for COVID-19, are healthcare workers or frontline workers who are dealing with COVID-19 or are in a containment zone should be tested. People should be tested if they have symptoms and they are hospitalized, especially if they're currently hospitalized and then develop symptoms. And people should also be tested if they're asymptomatic but have come into direct contact with someone who did test positive. It's good to kind of try to calculate the days since you've seen someone who has an infected so you can try to get an accurate result. So they say within 5 to 10 days of coming into contact with a positive individual. Next slide, please. Sweet, okay. And just in general, the most important thing to take away from the testing section is that testing is essential to control the spread of both HIV/AIDS and also COVID-19. If everyone knows their status, we can reduce the transmission of both diseases. And the only way to know that someone has either of them, either COVID or HIV, is to get tested. It's recommended that everyone get tested for HIV at least once, and especially important, and we would say even critical, that people who are engaging in any kind of risky behavior get tested 3 to 6 months after that behavior. So if people are coming into contact with any fluids indoors, they need to make sure that they're getting tested. It's also important that people who meet the current testing criteria are getting COVID tested. And even if you don't meet the criteria, it's especially important that everyone is being safe, wearing a mask, and social distancing. So that is the end of this section. I think we can move to the next slide.
Hi everyone, my name is Madelyn. Louis introduced me earlier, and I made a quick comment earlier. So I'll be talking about the treatment and care specifically of HIV and COVID. So if we look at the next slide, I'm going to be following kind of the same general pathway of information for both HIV and COVID. We'll go ahead and start with HIV. We're going to talk about general information, what to do if you or someone you know is positively diagnosed, what the treatment options are. We've talked a little bit about ARTs, which is antiretroviral treatment. We'll talk a little bit more in depth about that. And also some information for caregivers. So anyone who is responsible for assisting with the care of someone who's HIV positive. We're going to follow that exact same format for COVID-19. So looking at general information, what to do if you receive a positive diagnosis, what the treatment options are. This is an area that right now, again, is constantly in development, as Louis mentioned at the beginning. And we said in our disclaimers, this information is accurate today. There may be a new development tomorrow or the day after that. So this is the best information we have available to us now in the moment. Finally, we'll talk about caregiver information. So this is particularly pertinent now with COVID, what to do if you are in charge of caring for someone who's been diagnosed with COVID, or you cohabitate, you live with someone who has been diagnosed as positive with COVID. So on the next slide, please. So first we'll talk about HIV. And it's really important to know one's HIV status. Knowing that a person is positive is the first step to beginning to live a healthy lifestyle with the virus. It allows 3 distinct health advantages. The first is the ability to take control of one's health by properly caring for one's body. Another is an ability to protect loved ones by choosing to either abstain from or have safer sex. Those are those 3 ABCs that Stephanie talked about earlier. And finally, it affords the person with HIV positive status access to government-sponsored antiretroviral treatment. Being diagnosed with any chronic infection or disease is an experience that can bring a lot of different emotions. We know that in particular with HIV, because there is so much stigma associated with it, it can often produce feelings of fear or isolation with that HIV positive diagnosis that few other diseases can. So stigma usually stems from a lack of correct knowledge about HIV and AIDS, especially about the transmission of HIV. So what I do want to say is that each of you are taking a huge step in helping us to reduce the stigma associated with HIV simply by choosing to attend this webinar and be here today. If you can talk to anyone else about the information you've learned today, even if it's just one person, that's another huge step that you can take to help us reduce the stigma associated with HIV. So we know that individuals who are HIV positive who have access to social support structures, whether that's family members, neighbors, religious networks, whatever that looks like for them, people who have positive social support structures have a tendency to remain healthier for longer periods of time. This is because that positive living creates stronger emotional well-being, which in turn impacts the strength of the body's immune system. Utilizing those support networks can also help people to feel less alone and less worried about their HIV status. So looking at this slide, I'm sure you can guess what I'll indicate here based on these pictures. But what's important to take away from this is that healthy lifestyle habits are important for everyone, but they're especially important for those who are living with HIV. Because we've learned HIV attacks the immune system, anything a person can do to support and strengthen their immune system will give the body an edge to fight against the virus. So one example of healthy living, I'm sure you can think of many: drinking clean water, practicing good nutrition, getting healthy foods in meals, making sure that an HIV positive individual is engaging in regular moderate exercise, and also making sure to get enough rest and sleep. It's really important to give the body a chance to work on the immune system and continue to keep itself healthy. So on the next slide, let's talk now specifically about treatment. So antiretroviral treatment, which is sometimes abbreviated as ART, is the main category of treatment that we talk about when we're discussing treatment for HIV. So as we learned previously, HIV belongs to a category of viruses known as retroviruses. And antiretrovirals are drugs that combat HIV replication in the body in several specific ways. So ARTs can interrupt the viral replication process, so essentially stop the virus from making copies of itself, and thus effectively lower the viral load of the HIV positive individual receiving treatment. What that means is that when the HIV is not continuing to make more copies of itself within the body, there then is less HIV present in that body. So when we lower the viral load present in someone's body, antiretroviral treatment reduces the strain that's placed on the immune system. Having less HIV in the body gives the immune system a chance to recover and produce more of those healthy CD4 cells. Even though there is still some HIV in the body, again, we're not curing the HIV when we're taking antiretroviral treatment, we're only treating the HIV. The immune system is strong enough to fight off opportunistic or secondary infections. And the choice of an HIV regimen really depends on a person's individual needs. So this is something that an HIV positive person would talk to directly with their doctor. Some different factors that might be taken into consideration include possible side effects or potential drug interactions if that individual is taking more than one medication. So as we reviewed earlier, HIV medicines prevent HIV from multiplying, making copies of itself, which in turn reduces the amount of HIV in the body, called the viral load. And by reducing that amount of HIV in the body, HIV medicines can also reduce the risk of HIV transmission. A main goal of HIV treatment is to reduce a person's viral load to what we refer to as an undetectable level. So this is a phrase that is very common when we're talking about HIV treatment. It's really perceived as the goal. An undetectable viral load means that the level of HIV present in the blood is too low to be detected by a viral load test. And thus people with HIV who maintain an undetectable viral load have effectively no risk of transmitting HIV to others. And I'm going to say that sentence one more time because it's really important. People with HIV who maintain an undetectable viral load by taking their antiretroviral treatment as directed have effectively no risk of transmitting HIV to others. Additionally, people who are taking ARTs can extend their lifetime provided those drugs are taken properly. There's still people living with HIV 25, 35 years or more after they are diagnosed. So on the next slide, we're going to briefly touch on adherence. When we talk about adherence, we're specifically referring to taking a medication as directed. So that refers to taking it at the frequency that's directed. If your doctor says take it every day, you take it every day. Taking the dose that's directed, etc. So adherence to HIV treatment is critical, and taking prescribed HIV medicines as directed reduces the risk that HIV will mutate and become resistant to treatment. Skipping HIV medication dosage increases the risk of drug resistance and HIV treatment failure. Poor adherence also allows HIV to further weaken the immune system, which makes it more difficult for the body to fight off secondary or opportunistic infections. So just some quick statistics for you. In 2017, 56% of people living with HIV in India were on antiretroviral treatment, which is a significant rise from 2013 when coverage stood at just 36%. More women than men are on treatment, only by about 10%. And the proportion of children has not been reported, the proportion of children receiving antiretroviral treatment. Now we'll talk briefly about opportunistic infections, which we discussed earlier. Just as a reminder, opportunistic infections are infections that occur more often or are more severe in people with weakened immune systems than in people with healthy immune systems. So of course, this would be relevant for individuals who are immunocompromised, who are HIV positive. So people who are in later stages of HIV infection are especially vulnerable to attack from opportunistic infections, and compliance with the treatment regimen is crucial both for the efficacy of the individual's treatment and to protect society at large from drug-resistant forms of HIV. So on the next slide, we'll talk briefly about caring for someone with HIV. So again, if you or someone you know has HIV, it's important to note that most of the time, people in the AIDS stage of HIV infection do not need to be taken care of in a hospital. Many people who are HIV positive, who are taking their ARTs regularly, can live very normal, healthy, fulfilling lives. When people maybe do have weakened immune systems, or they are in those later stages of HIV, approaching AIDS or in the AIDS stage, when they are cared for at home, they have the advantages of a familiar environment as well as love and support that may not be found in hospitals. So remember, unlike COVID, HIV and AIDS cannot be spread through casual contact. Okay, the next slide, we're going to talk very briefly about the intersection between HIV and COVID as it relates to treatment. So I know I saw a question earlier about treatments for COVID, and are there treatments for other viruses that might be applicable for COVID? So I want to touch on that there's no evidence currently that there are medications used to treat HIV are effective against COVID. So although we're talking about antiviral medications in both cases, the mechanism isn't the same and it's not found to be effective for COVID. So it's important to note that people with HIV should not switch their HIV medication in an attempt to prevent or treat COVID. And additionally, some clinical trials are looking at whether HIV medicines could potentially treat COVID. Okay, so next slide, we're going to switch gears now and talk specifically about COVID care and treatment. So following the same kind of structure we did with HIV, what to do if you're sick with COVID-19. Most simply, just like we talked about with HIV, take care of your body. So this again includes proper nutrition, staying hydrated, getting enough sleep, making sure that your body has all of the tools it needs to keep itself healthy as best as it can. It's also really important that we wear masks for prevention, but especially if someone is positive for COVID-19, they wear a mask to prevent the spread of COVID to others. It's also important that that person stays home and stays in a separate room if possible. They can stay in touch with their doctor and take over-the-counter medicines to help them feel better, such as fever reducers or sore throat medicines. People with COVID should avoid public transportation, ride sharing, or taxis. They should cover their mouth and nose with a tissue when they cough or sneeze, and wash their hands often with soap and water for at least 20 seconds to prevent the spread of COVID. So on the next slide, we'll just go over briefly when to seek emergency medical attention. So most people who are positive with COVID have only mild symptoms and may recover within a week or two. But it is important to be familiar with the emergency medical signs. Some more severe symptoms that may show themselves with a COVID diagnosis include trouble breathing, persistent pain or pressure in the chest, new confusion, meaning, a change in consciousness that wasn't present previously, an inability to wake or to stay awake, or bluish lips or face. This list is not exhaustive. It's not a list of all possible symptoms, and it's important to contact a medical provider for any other symptoms that are severe or concerning. So next slide, let's talk about COVID treatment. Like I said, this is an area that there's a lot of questions about, a lot of, maybe you've seen some articles, you've heard some information from friends. It's important to really zero in on the facts here and separate them from kind of the rumors that we hear with any kind of disease development. So current COVID treatment options. Current clinical management includes infection prevention and control measures and supportive care. So for most severe cases, this might include supplemental oxygen and mechanical ventilatory support when indicated. Again, this is only in the most severe COVID cases where individuals would need that respiratory support. So there are only 2 currently recognized pharmacotherapies currently in use. One is remdesivir, which is a broad spectrum antiviral medication. So it's used in a variety of different viral infections. And a second is dexamethasone, which is a steroid that helps to reduce the inflammation in the body. So while these medications are currently in use and available, they're only approved for patients who are sick enough to be hospitalized and require supplemental oxygen. They're also both prescription medications, so they can only be approved of specifically by a doctor or healthcare provider. So again, no outpatient or at-home treatments have been approved. And when we say that, we're specifically referring to medications that would treat COVID directly as opposed to treating the symptoms. So again, you might take a fever reducer or a cough suppressant, but that's not necessarily going to directly impact COVID as a virus within your system. So that's kind of what we're talking about when we're talking about COVID treatment. So, of course, many pharmaceutical companies and laboratories around the world are working to develop medicines for COVID, and clinical trials are planned or underway to test a variety of drugs, including both investigational compounds, which may be approved for other illnesses, and also brand new compounds, looking at medications that haven't yet been developed whatsoever. So Megan, would you mind going to the next slide? I just want to make sure I'm on track here. So talking about treatment development, I just touched on this fact that clinical trials are underway. With any new disease, as it emerges, of course, there's time required to not only develop treatments, but to make sure that testing is done to test the efficacy and safety of that particular treatment. So there's limited evidence regarding specific antivirals that may work against COVID. And again, we're looking at experimental and effective treatments for the new disease. So finally, let's talk about some myths associated with treatment. Again, this is kind of along the lines of rumors, things you might have seen or heard, setting the record straight. So hydroxychloroquine and chloroquine are malaria drugs or anti-malarial drugs that were authorized for emergency use in the United States during the COVID-19 pandemic. And in the US, the FDA has withdrawn the authorization as data analysis has shown that these drugs are unlikely to be effective and they can also cause serious side effects. So here it's really important to note not to try any medications without a prescription and without a doctor's approval. It can be really tempting to try different options, especially if you feel like there's not a lot out there. But of course, for the safety of individuals and the population at large, it's really important that we wait for the explicit recommendation of scientists and healthcare providers before attempting to experiment with different medications. So finally, caring for someone with COVID or cohabitating with someone with COVID, if you live with someone, you know someone, your neighbor has COVID, whatever the case is, it's important to note to help the person who's sick follow their doctor's instructions for care and medicine. You can see if over-the-counter medicines for fever, for example, help the person to feel better. Like we talked about earlier, basic self-care around getting lots of rest, making sure that you're drinking water and getting appropriate nutrition. call a doctor if that individual keeps getting sicker, and to avoid contact when possible. So just because you live with this person doesn't mean that you shouldn't try to implement social distancing where possible. So if possible, that person should stay to their own room to separate them from the rest of the family or household members. Wear a mask whenever you must come into contact with that person. And finally, think about some creative ways to provide social and emotional support from a distance, such as via instant messaging, WhatsApp, a variety of different communication methods, so that you can still provide support to that person without putting yourself or others at risk of also being infected with COVID. So the last thing I want to emphasize is that unlike HIV, COVID spreads between people who are in close contact. So we know it's within about 6 feet through those respiratory droplets. COVID, again, is that respiratory viral infection in particular. And caregivers should be careful to limit contact with those COVID infected individuals. So keeping that space and also avoiding having visitors whenever possible to limit the spread of COVID-19. So that concludes my section, and we are now going to move into the Q&A portion of our session today. I want to acknowledge that we have about, it looks like about 15 minutes here for questions. I want to give time for Sheema to close. So we'll try to keep it between about maybe 10 or 12 minutes for questions. So if you have any additional questions, if you'd like to type them in the chat, I think that we'll go through and try to answer as many as we can. Does that work for everyone?
Madeline, there was one from earlier that I can address as we wait for them to come in. The question was, how do we engage semi-literate, very poor communities with children infected with HIV on the scientific basis of HIV if communities are to take ownership of their health conditions? So suggestion that I'd like to offer for that, it is helpful, we have found, to frame HIV, when discussing HIV with children, to frame it as almost superheroes versus bad guys, our immune system being the superheroes and HIV being the bad guy, as HIV tries to sneak inside body cells. The immune system, which is the superhero, fights back, and to do so, whenever possible, we should give the immune system clean water, ARTs, and healthy food to power that fight back. And there was a great mentioning of sometimes poor communities not having access to that nutrition. Brittany addressed that in the chat. IAPA does some work to try to provide that nutrition to families who can't afford it, but we know that poverty is a big barrier for public health. So thank you for that question.
Also, Stephanie wrote this in the chat. She got one of those breaking news alerts on her phone, but today CNN, which is a news organization in the US, announced that the COVID-19 cases in India have passed 4 million. And yesterday was the highest single rise day in infection. So it's really great that everyone who is living in India is here at the webinar and trying to learn. We also try to learn all the time about it. We're also learning each day ourselves. And so it's important to continue trying to stay at home, social distancing, avoiding touching your face, as I just did, like try wearing a mask, and making sure that you're sharing the information that you know, and trying to keep everyone safe. Also, if we missed any questions in the chat, please let us know. We tried to answer them as we went, but.
In the meantime, while we may not have other resources, education is one of our most powerful resource. So whatever we can do to decrease stigma and share this information with our communities will help.
I'll just comment as well. I know there were a few comments in the chat indicating an interest in either the PowerPoint or a recording of this webinar. So I do want to just confirm that we are recording this webinar, and each of you will receive a file or a link to this webinar that you can watch again, or you can share with someone you know. We'll also do our best to get the PowerPoint file shared with everyone as well, so that you can review any of this information on your own time.
Good morning, everyone.
Good morning.
I'm Binu from VIT Chennai, and I'm assistant professor handling sociology and psychology. And I'm closely associated with IAPA, and with their support, I've started the Red Ribbon Club because my entire MPhil and my PhD is on HIV/AIDS. So I was working with PWN Plus, and then I was with IAPA and did lots of work on the societal and attitudinal change, behavioral change. Well, the session was very informative and a learning session because we keep hearing about this COVID-19 since January onwards. And like HIV, I felt there are lots of myths and misconception about COVID-19 as well. And I feel both has a stigma and discrimination in the society and has created a boom over there. Recently, there was a news that the medicine that has been used for HIV, AIDS, and TB has been used in addressing the COVID-19 cases. And then now we keep hearing about the plasma therapy that has been initiated everywhere. Now in US also they have agreed in taking the blood and everything. As I'm dealing with students, it is very difficult to handle students on terms of creating an awareness of sexual health. It is very difficult at the present scenario. I want to know how innovatively we can really create it is not about creating, educate the students, the young generation, because it is very difficult to educate me because I have grown up and like I can understand. It's like I'm telling about the generation which has passed, the generation which is going to come, the teenagers or the adolescent, how as a social worker, as a social responsibility, we can bring about a change. I just want to know about it because this is not a situation in India, it's a global situation. Because I think almost we are in webinar always we are in webinar. And but apart from that, how can we really create an awareness in terms of educating? We keep saying education. Apart from that, how can we really create an awareness on HIV or COVID or sexual health or social distancing or mask, all these things? I'm just getting your suggestion. That's it.
Well, that was a great question. Thank you. I would say one approach would be to find the leaders, the student leaders in your classroom and at your school, and ask them what the culture is among the students and what they think could be possible ways to break that stigma and barrier when talking to. IAPA works with CPs, with some students from the school, the Madras School of Social Work, and
Okay.
and they were just instrumental when we did our teachings. So I think that maybe putting together a team could be helpful.
Okay, thank you so much.
I also think, just really quickly, one thing that's interesting that IAPA does that like a lot of other organizations do as well is noticing the intersection between education and health. And IAPA works by teaching young people in schools about HIV/AIDS and hoping to break the stigma with people who are still so willing to learn and who haven't been totally conditioned into the ideas of the rest of society. And I think the same thing could be done with COVID-19. There are like lots of really interesting ways to engage young people on social media right now, especially because no one can really meet in person, and using those kind of platforms to teach facts and to get rid of myths and to reduce stigma. I think that's like a really great way. I'm not like a personal expert on social media, but I do see it as like an interesting platform to like teaching kind of larger groups of people about anything, whether it be HIV or COVID-19.
Also, Brittany and Stephanie, those are so great. And this is Megan. Your question is fantastic and something that's has proven difficult to do, right? One thing I wanted to bring up was, you said we're always in webinars, we're always doing education programs, right? You're told do education and teach and teach and teach. But one thing we know about public health and public health behavior change programs is that just knowledge alone does not change people's behavior, right? We know that we should wear a mask to prevent the spread of COVID, but not everyone in the world wears a mask, right? We know we should wear condoms to prevent the spread of HIV or other sexually transmitted infections, but not everyone wears condoms, right? So there's a deeper underlying, behavior change focus that our education programs need to take. And this webinar is kind of an overview of COVID and HIV, but a lot of the programs that IAPA is doing, as well as other, community groups, which there's some great comments in the chat about community mobilization, a lot of those efforts are towards actually encouraging behavior change. And as someone who's with students, who's teaching and dealing in the areas of psychology and social work, you probably know a lot about how behavior change is working. And I would encourage you to look up some of the methods that other organizations have used around behavior change messaging. And part of that, one of the things I've done, I research HIV stigma in East Africa. And one of the things I've done is tried to understand how to break down this barrier so that people actually change their behavior. And one of the main ways I found to be able to do that is that you have to have students, it takes a long time, it takes dedicated work, but you have to have students talk about what's important to them. You have to have them connect what they're learning about their health and what's going on in the world to what's important to them. And only then can their motivation for, achieving whatever type of life they want help encourage them to participate in positive health-seeking behaviors. So anyways, that's a longer discussion, but I think your question is really great and something I hope everyone on this webinar thinks about how we can focus on in the future.
Thank you so much. Thank you.
Wonderful. So I want to acknowledge our time. We have about 5 minutes left. So Sheema, I know that you were going to do a closing if you're ready to do so. If anyone has any additional questions or comments, please feel free to leave them in the chat. And Sheema, I'll pass it over to you.
Hi, I'm Sheema. So thank you all for participating. Thank you all for participating and making it an interesting session. Especially I want to thank all my SIP volunteers, and happy to see you all again. And Madelyn ma'am and Binu ma'am, thank you very much. I'm very excited that this was a very live section with a lot of questions and very informative. I hope all of you have got a lot of information. I had a lot of learnings from this, and hope this will be passed on to your family members. First, we'll start with our family members, then spread to the community. We all together join hands and make it a successful event. Thank you very much.